Hi, and welcome back to the Dr. Ramsey Show. Recently, I've been sharing with you information that's hitting the news about women's health and hormones, which has been so refreshing to me. I've shared with you some of the things that were written that maybe weren't correct, but overall, the fact that women's health is getting attention is so heartwarming to me. Today, I'm going to talk about men and testosterone, and this is from Mayo Clinic. And I'm just going to read it to you, and I'll interject where I'd like you to understand that maybe what they're saying may or may not be exactly true based on the research. So, Mayo Clinic, sexual health publication. Testosterone therapy, potential benefits and risks as you age. What I'm so grateful for is to know that the risks in aging are in not taking hormones. Bioidentical hormones are not risky, synthetic ones are. So we're going to review the benefits and risks of taking testosterone in men. Considering testosterone therapy to help you feel younger and more vigorous as you age, know the risks before you decide. That's the subtitle. As you age, testosterone therapy might sound promising, but there are a lot of misconceptions about what the treatment can and can't do for you. Testosterone therapy might seem like the ultimate anti-aging formula, yet the health benefits of testosterone therapy for age-related decline in testosterone aren't clear. According to the research is clear. So they're saying it's not clear. Find out what's known and not known about testosterone therapy for normal aging. The influence of testosterone in men. Okay, testosterone is a hormone produced primarily in the testicles. Testosterone helps maintain men's bone density, fat distribution, muscle strength and mass, facial and body hair, red blood cell production, sex drive, and sperm production. So that's what testosterone does naturally, not taking it, but making it. What happens to testosterone levels with age? Well, testosterone levels generally peak during adolescence and early adulthood. As you age, your testosterone level gradually declines, typically 1% a year after the age 30 or 40. I'm personally seeing lower levels in younger men. The reasons being, like in my really young men in their 20s, abdominal fat. That's going to reduce testosterone significantly. I think the foods that we eat are contributing. The stress levels are, so high in our population, but there's a lot of low levels even in younger men. Andropause, women go through menopause and men go through andropause, hampers the ability to produce normal amounts of testosterone due to a problem with the testicles or the pituitary gland that controls the testicles. Testosterone replacement therapy in the form of injections, pellets, patches, I don't use them, gels, I don't use them, can improve the signs and symptoms of low testosterone in men. What I use are injections most commonly and creams. I used to use pellets, but I don't think they protect the prostate as much. Does a naturally declining testosterone level cause the signs and symptoms of aging? Changes in sexual function. This might include reduced sexual desire, fewer spontaneous erections, such as during sleep, and infertility. And I see that some men have challenges completing an orgasm, which is not uncommon in men if they hadn't for a while. To me, it has so much to do with what we're thinking. Physical changes. Various physical changes are possible, including increased body fat, reduced muscle bulk and strength, and decreased bone density. Swollen or tender breasts and body hair loss are possible. Why are men getting tender breasts? Well, as men lose their testosterone, and testosterone's that fat burner, breast tissue is fat, they can't burn that fat with low testosterone, and therefore they feel the fat on their breast. That's the only reason. Emotional changes. Low testosterone contributes to a decrease in motivation and self-confidence. And I see this a lot, and I love what I see once they go on it. You might feel sad or depressed, yes, or having trouble concentrating or remembering things. Some of these signs and symptoms can be caused by other factors, including medication side effects. True, my men who take a lot of medications, it's harder to get all the benefits in using testosterone, obstructive sleep apnea, thyroid problems, diabetes, and depression. It's also possible that these conditions cause low testosterone levels. Yes. So treatment might result in increase of testosterone levels. Yes. A blood test is used to diagnose a low testosterone level. Now, what I want to share is to diagnose a low level, the FDA has defined a total testosterone level of 300 or less to be considered low. Nothing with the free, just the total 300 or less. And then those men who are approved for it have access to what's commercially available. Androgel, Axelron, CVS, Walgreens. Those are my female doses. I don't use them personally. Can testosterone therapy promote youth and vitality? Testosterone therapy can help reverse the effects of hypogonadism, but it's unclear whether testosterone therapy would benefit older men who are otherwise healthy. I would ask, why not? If they're healthy and they might have, some small symptoms, testosterone can make a big deal. And we have to remember that the higher our testosterone levels in men, the lower our risk for long-term prostate cancer. That's a big deal for me. Healthy, I was writing this. These are my notes. Healthy means to me that men can function sexually and have lean body mass if no symptoms. Doesn't mean testosterone is contraindicated. Why? High levels of testosterone decrease the risk of prostate cancer. And believe it or not, some men with low levels function just fine. So that was me. Here's the article or the write-up. Although some men believe they feel younger and more vigorous if they take testosterone, there's little evidence to support the use of testosterone in otherwise healthy men. Correct. Not by the FDA. What I do is not FDA approved. Guidelines from the American College of Physicians indicate that testosterone therapy might improve sexual function somewhat in some men, but there's little evidence that it improves other functions such as vitality and energy. Testosterone increases vitality and energy in every man. Every man will feel it differently. Start around age 50 and you'll maintain that the rest of your life. Okay, now we're going to talk about the risks. Worsening sleep apnea, that is true. I don't know why, but if you use your machine, you'll be just fine. Causing acne or skin reactions. Yes, the research says 10% of men who take testosterone will have acne. That's true, just 10%. Stimulating non-cancerous growth of prostate. Untrue. And growth of existing prostate cancer. Well, yes, if there's a cancer and it's being treated, you don't want to use testosterone, you want to wait. However, testosterone is very safe on the prostate. Men can live years with prostate cancer if it's not metastasized. If it has metastasized, okay, that's a whole nother picture. But men live with prostate cancer for a long time if it's not metastasized. Enlarging breasts is not a risk of giving the right dose of testosterone. Enlarging breasts is a risk of taking the commercially available low-dose testosterone preparations. It limits sperm production. Yes, when men are on testosterone, they are not fertile. They can become fertile by going off of it. Stimulating too much red blood cell production. This is normal in every single man because their levels are high. Testosterone raises red blood cells, hemoglobin, and hematocrit. There is zero risk, but it goes on to say, which contributes to the increased risk of forming a blood clot. Not. Testosterone does not increase the risk of blood clots. In one article, it wasn't even an article, and we went over this before, testosterone does not increase the risk of blood clots. If it increased platelets, I would agree, but it doesn't. Platelets cause clots. A clot could break. Okay, forget that. Also, some research shows that testosterone therapy can increase the risk of heart disease. More research is needed. Well, the heart's a muscle. Our muscles need testosterone. It does not increase the risk of heart disease. I've never seen that. And in fact, I'll close with this. So there's one cardiology clinic in Mesa that sees a few of my patients that says that testosterone increases the risk of atrial fibrillation and irregular heart rate. I keep asking my teacher about that. He says, no, it doesn't. No, it doesn't. It does not. There's not one article. But they see this. And I haven't heard it from any other, cardiology center. So that's the only one that has been said because of what they've seen, but I haven't seen an article on that. And it's only really those patients that I see when they go up on their testosterone, they get some AFib. I don't see that with other patients. So, thank you for listening to this because yes, testosterone is great for men. Men have greater access to care in the aging process compared to women. Urologists are very much more open than GYNs are, giving hormones. So men have it good. Now we just want men to get the right dosing. And the dosing of testosterone injections that I give is 1 cc. It's 200 milligrams per cc twice a week. So that's it. That's in the injection. The cream is going to be 200 milligrams twice daily to the skin. So thank you for listening. Have a great day. We'll see you next week. Bye-bye.